In the mid-20th century, a dark and controversial chapter in the history of mental health unfolded. It was a time when society grappled with deeply ingrained biases and misconceptions, and the consequences were nothing short of shocking, quite literally. Electroshock therapy, a procedure intended to treat various mental conditions, was employed in an attempt to cure homosexuality. It was a practice born out of ignorance and prejudice, an era when the understanding of human sexuality was clouded by stereotypes and stigmas. In this video, we delve into a haunting tale from the past, exploring the grim history of electroshock therapy and its misguided use on those who simply dared to love differently. Join us as we uncover the shocking truth behind a treatment that left scars on countless lives and examine the lessons it offers us about the importance of empathy and acceptance in the world of mental health. Our journey begins in the mid-20th century, a time vastly different from today. The societal attitudes and beliefs about homosexuality in this era set the stage for the use of a controversial and harmful psychiatric treatment. In the post-World War II era, conformity was the norm. The ideal American family was depicted as a heterosexual couple with children. Any deviation from this norm was met with skepticism and, in many cases, discrimination. Homosexuality was widely stigmatized and considered a mental disorder by the American Psychiatric Association. The prevailing belief was that being LGBTQ was something to be cured or fixed, as it didn't align with the societal norms of the time. To understand how electroshock therapy became a part of the disturbing history of attempting to cure homosexuality, we need to explore the origins of this psychiatric treatment. Electroconvulsive therapy, or ECT, as it's formally known, was first introduced in the 1930s as a treatment for severe mental illnesses like schizophrenia. It involved inducing seizures in patients through the application of electrical currents to the brain. Pioneering psychiatrists like Ugo Cerletti and Lucio Bini in Italy, and Arthur S. Freeman in the United States, were among the early advocates of ECT. They believed that the convulsions induced by ECT could somehow reset the brain, alleviating symptoms of mental disorders. However, its application soon extended to other conditions, including homosexuality, in a misguided attempt to treat what was then considered a disorder. Many LGBTQ individuals who were subjected to electroshock therapy during that dark era carry the scars of their experiences to this day. Their stories offer a sobering glimpse into the pain and trauma they endured. In the mid-20th century, electroshock therapy was heavily debated within the medical community. While some psychiatrists believed it was a legitimate form of treatment, others questioned its efficacy and ethics. Critics argued that there was no scientific basis for using electroshock therapy to cure homosexuality. They pointed out the absence of concrete evidence supporting its effectiveness, raising doubts about the practice's ethical implications. The controversy surrounding electroshock therapy for homosexuality wasn't limited to its medical aspects. It also raised profound ethical questions about the treatment of LGBTQ individuals and the infringement on their rights. The use of ECT to alter an individual's sexual orientation ignited a broader debate about the autonomy and dignity of patients. It was seen as a violation of a person's right to self-determination and personal identity. For many who experienced electroshock therapy, the repercussions were severe. The procedure often left individuals with physical injuries, including burns and fractures, as a result of the induced seizures. The psychological trauma was even more enduring. Survivors often grappled with severe emotional distress, including post-traumatic stress disorder, anxiety, and depression, stemming from the painful memories of the treatment. The legacy of electroshock therapy for homosexuality serves as a grim reminder of the harm caused by misguided medical practices. It underscores the importance of prioritizing the well-being and rights of individuals, regardless of their sexual orientation. In the latter half of the 20th century, a burgeoning LGBTQ rights movement began to challenge the status quo. People came together to demand acceptance, equality, and an end to harmful practices like electroshock therapy. Over time, legal and medical institutions began to recognize the need for change. The American Psychiatric Association declassified homosexuality as a mental disorder in 1973, marking a turning point in the understanding of LGBTQ individuals. The changing attitudes toward LGBTQ rights and mental health treatment were hard-fought victories, driven by the courage and determination of countless activists and allies. Today, we celebrate progress in LGBTQ rights and mental health support, but we must also remember the painful history that led us here. As we conclude our journey through the dark history of electroshock therapy for homosexuality, it's imperative to reflect on the lessons this somber past offers us. We've come a long way since those dark days, thanks to the courage and resilience of the LGBTQ community and their allies. It's a testament to the strength of the human spirit and the capacity for change. Thank you for joining us on this journey. If you found this video informative, please like, share, and subscribe. Your support helps us continue to explore the past, understand the present, and shape a more compassionate future.